Don't choose a hair transplant clinic without watching this video. Most clinics offer patients a free consultation. Did you know that a free consultation is actually a sales pitch rather than a medical consultation? If you want to learn more how a real hair transplant consultation is, I recommend you stick around until the end of this video. So let's get into it. For those who don't know me, I'm Dr. Ali Emre Karadeniz, plastic surgeon, practicing hair restoration surgery exclusively in the last 15 years. And I'm located in Istanbul, Turkey. So let's start by discussing what is a hair transplant consultation and how is it different from sales pitch or a sales talk. We will often see free consultation. Did you ever think about it? What is a free consultation? Free consultation. Let's get deeper into it. So, there is a huge difference between a consultation and sales talk. I'm saying sales talk because it's a talk between two people. It's the patient and the person talking. I'm not saying sales pitch because sales pitch is, the person who's selling. But sales talk is two ways. It's between patient and the person selling. So, let's look at it a little deeply. A consultation needs to be done by a medical doctor, actually the person who's going to offer the treatment itself. A consultation can't be done by someone who's not the medical professional. A sales talk can be done by a salesperson. A consultation should always be paid. So if it's not paid, this is not a consultation, it's a sales talk. Why does a consultation have to be paid? Because the person who's doing the consultation, in this case a medical doctor, there should not be any financial incentive. So you have to take the incentive away from that person so it becomes a consultation and not a sales talk. If it's free, it's obligatory for the person to try to sell, which is not to the patient's benefit. So I see oftentimes patients looking for a free consultation. That's a grave mistake because actually for the patient's benefit, it should be a consultation, a paid consultation. If it's free, now it's not a consultation anymore, it's a sales talk and only the person selling is going to benefit from it because the whole planning of that talk is going to be aimed at sales. The other thing is that a consultation must be live because in a consultation, there has to be physical examination by the doctor. Can't give a consultation with no physical examination because a consultation is not providing general information. It's specific information for that patient and therefore a live examination is a must for that consultation. Whereas a sales talk could be live or it could be online as well. So I often see like free online consultation, or I see online consultation. Can't have an online consultation in medicine. You can have an online consultation if this is law, but you can't have an online consultation if this is medicine because physical examination is a must. In a consultation, there has to be diagnosis and recommendation of a treatment. Whereas in a sales talk, there's no diagnosis. In a sales talk, there is a negotiation for the sales. And it's two ways. The selling person, the salesperson is trying to sell and the patient is deciding whether she wants to buy it or not. So there's negotiation. Whereas in a consultation, there should be no negotiation. There should not be any financial incentive in a consultation, in a medical consultation. In a consultation, there should be no trying to convince having a treatment or having surgery because this should be based on medical indications. So a treatment should only be recommended if the patient needs it. Whereas in a sales talk, there's no such thing as need because then need is subjective. Actually, from the salesperson's perspective, the sales is needed. So therefore, the treatment is needed so the salesperson can profit from it. So I see like patients going through a sales talk and asking questions like, do I need this treatment? That's a silly question because if this is a sales talk from the person's perspective who's selling, it's definitely needed. so they can make money. So there's no point in asking, do I need... See, I'm not saying a sales talk is wrong or shouldn't be done, but I'm just saying that if this is a sales talk, it should be treated as a sales talk. And if it's a consultation, it should be treated as a consultation. Okay, so the goals of these two are entirely different. Some years ago, I tried doing free consultations, and it's real sense. So I tried to do real free hair transplant consultations, and I was almost risking losing my business. Because I would spend an hour with a patient without charging anything. I would usually not recommend treatment. In fact, in an honest and real consultation, a treatment, a surgery should be avoided if possible. Because if it's not absolutely necessary, it's in the best interest of the patient to not have any treatment. So I would not try to convince patient having surgery, so I would keep doing consultations, and most of the time there would be no treatment sold. So I would spend my hours without making any money and would not end up selling any treatment. So I was going to lose my business. So I realized that this is impossible. So that taught me. I then realized the difference between consultation and sales talk. But of course, as a medical doctor and a person who thinks I'm ethical, I'm not going to do sales talk. So if this is a sales talk, a sales representative should do it, not me. Because I'm a medical doctor and I'm ethically responsible to provide consultations, not sales talks. So now that you understand the difference between consultation and sales talk, I can go into a general consultation, okay? But I have to say, this is general information excluding special hair loss reasons, diseases that need physical examination, laboratory tests, and all those are excluded. So I'm going to talk about male pattern hair loss, also referred to as androgenetic alopecia. Sometimes seen in women as well. But it's not an underlying disease. It's just the sensitivity of hair follicles to the DHT hormone. Okay, so there's no underlying disease. So I'm going to talk only about that because the others would definitely require a live examination and a real consultation. So this is a general consultation excluding those special conditions. This will also exclude special health conditions a patient may have. So let's say you have male pattern hair loss, but you also have a heart disease. That needs to be diagnosed and analyzed or evaluated specifically so to understand if you can be a candidate for hair restoration surgery or not. So I'm excluding those special conditions as well. I'm going to also exclude hair transplant design and planning in how the hair transplant should be performed, but because that also needs a physical examination of each person. So I can't give a generalized overview of how a hair transplant should be done and how it should be planned because it should be done individually. So let's firstly understand what hair loss is and what is a hair loss treatment. Okay, the most important thing to understand that there's a difference between hair loss treatments and hair transplant surgery. Hair transplant surgery is actually not a hair loss treatment. Hair transplant surgery is actually not a hair loss treatment because it does not prevent hair loss. Okay, so I could rephrase hair transplant surgery, or even the word hair restoration surgery is not entirely correct because we cannot restore what's lost. Lost is lost. There's nothing to bring back lost hairs. So what we do in a hair transplant is we redistribute what is left. So I'd rather call it hair redistribution surgery because we're not adding any new hairs. I see some adverts saying, get your hair back. You can't get your hair back. There's no such thing as getting your hair back. Lost is lost, and you can only try to retain what you already have. Okay? And you can redistribute what you have so it looks better. So hair loss treatment is done to prevent or slow down hair loss on what you already have. It won't bring new hairs, it won't bring lost hairs back, or it won't add new hairs. It will just protect the remaining hairs. That's what hair loss treatment is. And hair loss treatment is done by taking medication, mainly minoxidil, finasteride, and so on and so. So these are medication used for male type hair loss, androgenetic hair loss. Okay? So what these do is they protect what's left, but they don't bring back new hair. They can thicken up the existing hairs, so it can look much better if you consistently use them, but it won't produce new hairs. On the other hand, hair transplant surgery will do nothing to prevent hair loss. It will just redistribute what's left. So this is the basic you have to understand about hair loss and what hair transplant surgery actually does. So next question is, what is hair transplantation and what it actually isn't? So that's what we have to understand. So I just mentioned hair transplant surgery is not a hair loss treatment and it does not prevent hair loss. It redistributes some of what is left. So it can't redistribute everything, it redistributes some of what is left. So in hair transplant surgery, we have some terms that you need to understand. The first one is donor area or donor capacity. Donor area is where you take hairs from. Donor capacity is the amount of hairs you can take, lifetime. Since we're not adding any new hairs and we're just redistributing what is left, there's a limited amount of hairs you can redistribute, lifetime, and that's called the donor capacity. Meanwhile, we have to understand, how can hair transplant surgery be done? The reason why hair transplant surgery works is because for unknown reasons, or not totally understood reasons, a certain area on the scalp is sensitive to hair loss. And that's usually the top of the head, from the front to back. Okay? So this area can lose some of the hairs or even all of the hairs. That's the sensitive area. It means this area becomes the recipient area in hair transplant surgery. It receives hairs. The other area is the area starting from one ear going all the way across the back and towards the other ear. And that's called the donor area. So that's the more resistant area. I can't say that this area is 100% resistant, but it's mostly resistant, or at least more resistant than the top. Which is why, and as I said, we don't exactly know why that area is more resistant to hair loss. But as a consequence, this allows us to actually steal some of that hair and use it in the balding area, in the recipient area. And another thing is that native hair is so dense that even if we end up losing close to 50% of that hair, the density is close to sufficient. We can't see through the scalp unless 50% or more of the hair is lost. So we use this extra capacity as the donor capacity. This tells us that we can take up to 50% of the donor area and move it somewhere else while that area still looks good. Still looks dense enough. Of course, it changes from patient to patient, but I'm giving a rough number here. Next is to evaluate hair loss and to classify hair loss for surgical restoration. So I have my own classification system that I do for each patient's hair loss. So what I do is I quantify the amount of hair loss versus the amount of donor capacity and classify it as mild, moderate, advanced, and very advanced hair loss. This classification tells me what I can do surgically and what results we can expect. What are the realistic goals? The more advanced hair loss is, the more limited we will be with what we can do, obviously, because more advanced is more hair loss and less donor capacity. Okay? Less donor capacity and more hair loss means we can cover less. So we can only do less in those situations. So in mild, moderate hair loss, we can perhaps mimic a full head of hair. And in advanced cases or very advanced cases, it may not be possible to even try to provide a full head of hair. Don't forget, we're not adding any new hairs. So here you have to understand, Hair transplant surgery, the goal is to actually create an illusion of a full head of hair. It's an illusion because in its real sense, there's no restoration and there's no hairs added. So it's an illusion. That means with special professional designing and application with a limited amount of hairs, we can make it look much better than it actually is. And that's why it's an illusion, okay? And obviously, that illusion has limits as well. So the more advanced hair loss is, the less we can do. But on the other hand, the more advanced hair loss is, the more dramatic the improvement can be, even if it's not a full head of hair. We can make it look much better than it actually is. A lot of patients ask me, how many grafts or how many hairs do I need? I mean, I'm covering this topic in another video, but what I want to just quickly say here is that since in most cases hair loss exceeds by far available donor hairs, there is no such thing as how many hairs or how many grafts I need, because we simply need everything that is available and even more. So that question just becomes irrelevant. A more relevant question would be, what result could I expect realistically? But how many hairs do I need or how many grafts do I need, which is a very frequently asked question, is actually irrelevant if you understand the dynamics of surgical hair restoration. Next is hair transplant design and planning. Obviously, I can't tell you how I would design your hair transplant because I would need to do a live examination. But the general principles are hair transplant design and planning should not be done on the basis of what we want, what the patient wants, what the doctor wants, what the patient relative wants. These are not relevant. What matters is what can be done. So in my examination, my consultations, my planning and design sessions, I focus first on what can be done rather than what we want. Because if we move forward with a plan based on what we want but can't be achieved, the result would be disastrous. So it's very important to first understand what can be done, and then from the available options try to see which one we would like more. So let's now quickly look at the steps of the surgical procedure, okay? So hair transplant surgery consists mainly of 3 steps, of course excluding the planning and design, which could also be seen as a step of the surgery. But from the real surgical procedure, it's 3 steps. It's donor harvesting, then it's recipient site creation, and then it is graft placement. So it consists of 3 parts, which may have some alternative names as well. Okay? Donor harvesting is aimed at obtaining donor hairs. Obtaining donor hairs from the scalp can be done using 2 techniques. One is FUT, the strip method. The other is FUE, the punch method. So I'm not going to go very deeply into these methods, but let's go briefly through it. So the strip method is done by taking a long and thin strip from the back of the head, surgically removed, stitched and closed, and then the strip dissected under the microscope to create single graft units. These grafts may contain anywhere between 1 to 5 hairs each. Of course, if it's unprofessionally done, it could contain 0 hairs, but obviously professionally done, it contains between 1 to 5 hairs. And of course, the more live hairs it contains, the better coverage you can get from these grafts. So in the strip method, we remove a skin strip, dissect this strip under the microscope to create individual grafts containing 1 to 5 hairs. So in the strip method, we take the strip and then the rest of the dissection is done out of the body by a team doing the dissection under microscope. In the FUE method, an instrument called a punch is used, and this can be a manual one or one that's installed on a rotary motor. So there's various types of instruments, but in the end, it's like a cylindrical metal tube that we use to cut through the skin to take out cylindrical pieces of skin, usually 1 millimeter or smaller, which we also refer to as grafts. So that instrument is called a punch, and each punch takes out an individual graft. So the grafts are taken out one by one through the punching method in FUE versus taking one large piece of strip in FUT and then cut under a microscope. In FUE, we punch them out one by one. So the goal of donor harvesting is to get as many live hairs as possible while removing as little tissue as possible. Okay, so here again, this is a topic of another video that I covered extensively. That's about the graft, the term graft. But the goal of donor harvesting in reality is to take as many live hairs as possible while taking as few grafts as possible. As little, because graft is removed tissue and we want to remove as little tissue as possible so that we create the least amount of scarring, the least amount of tissue damage, blood vessel damage, nerve damage, okay? But we want to take the most amount of hairs, live hairs, but the least amount of tissue damage. Next stage, the second stage of the hair transplant is doing the recipient site creation. So that's doing tiny cuts on the recipient site so we can push the grafts in to their new site so the hairs grow in that new location. Mind you, when we do donor harvesting, we are removing tissue. But when we do the recipient site creation or recipient site incisions, we are usually doing tiny cuts. We don't actually need to remove tissue because the tissue is elastic enough to take that extra tissue without actually removing anything from it. So that's why it's kind of easier there, and there's less damage done at the recipient area because there's no tissue removed. It's just tiny cuts. The last part of a hair transplant is the placement. So the individual grafts that were harvested from the first part, whether it be FUT or FUE, are placed into the incisions done in the second part using an instrument called a forceps. Are carefully put in. There are some alternative instruments and methods, like there's also an implanter pen used, which the graft is put in a special instrument, a pen. So the pen is pierced through the skin. So you don't need to make the second part recipient site incisions. The pen will do its own incision and then you eject the graft into the recipient site. So the implanter pen, a lot of clinics use the term DHI. It's actually a private brand of a company, but it's used so much that it's used instead of the implanter pen. So the implanter pen combines the two parts, recipient site incisions and placement, in one go. So it makes its own incision and then ejects the graft into the recipient site. So it's referred to DHI. There's different blades and instruments used to make the recipient site incisions. There's a metal blade, glass blade. One company gave the name sapphire blades for those glass blades. Important to understand here is that the instruments used, techniques used in hair transplant surgery don't matter much. It's how it's done, it's how professionally handled that actually determines the quality of the surgery. So every surgery, every surgeon, every surgical team may be good at a certain technique or using certain instruments. It doesn't matter which technique or which instruments are used. What matters is how well it's performed. So here it's important to understand that focusing on instruments and techniques actually deceives the patient and actually allows for some marketing, which some scammy clinics like to do because they like you to think like they have the latest technique, latest technology. It doesn't matter. Frequently, scammy clinics will emphasize latest techniques and technologies. Professional clinics will just say, well, I just use my own technique. Doesn't matter which technique you use. Doesn't matter. Let's say if you go to a high-class restaurant, it doesn't matter in that high-class, let's say Michelin star restaurant, doesn't matter which brand knife the chef uses to cut the food or which pan they use. It doesn't matter. It's how professionally they actually do these things that matters. So always don't focus on instruments and techniques and focus on the quality of the treatment, the quality of the surgical team, the credentials of the surgical team. Also, don't focus on grafts because a graft, as I said, is a vehicle and it doesn't determine the quality of the surgery. Okay, so now that the surgery is done, let's look at basic aftercare, okay? The first thing I'd like to tell is that the aftercare is not as critical as you may think. Because if you follow some basic instructions, there's not much that you're gonna do to either damage or improve the result during this period of healing. Okay, there's some basic knowledge you need to know, and the rest is pretty simple, and it's not as critical as some people may think. When a hair transplant is freshly done, the first few days, I would say the first 3, 4, or maybe 5 days, is critical for the survival of the transplanted hairs, okay? And in these days, if you if the scalp receives any kind of trauma, touching, rubbing, or bumping somewhere, or like pressing a hat onto the scalp, the grafts could actually move and you could lose some of the hairs. So it's important to be gentle and careful for the first few days. Okay, that's actually mostly what you need to know about the aftercare and healing. So just don't like have an accident in the first 4 to 5 days. Don't touch and rub it so to move the grafts. On the other hand, immediately after the surgery, if you professionally follow the instructions, it's possible to wash the head gently daily. So it's okay if like running water comes down the scalp, and it's okay to like pat some shampoo over the scalp while it's being washed, unless you actually rub it. And it's okay to use a towel and pat the scalp dry if it's wet from the washing. It won't damage the grafts, okay? And as I said, once you've passed those few days, 4 or 5 days, there's not much danger anymore to the transplant. And also to add, there's not much you could do to improve the result either. So like there's no any magical shampoo or lotion or cream or serum or anything you could do to get a better result, okay? Excluding hair loss treatment by medication. Hair loss treatment by medication will protect you against further hair loss, strengthen existing hairs, but it's not necessary for the success of the hair transplant. A frequently asked question is, do I have to use medication? Okay, again, it's a wrong question, because the hair transplant does not depend on medication. It will succeed if it's done professionally, but in order to get a good set of hair, which is obviously a wider term, you may need both a succeeding hair transplant and the prevention of hair loss and the protection of existing hair. So don't confuse success of a hair transplant with having a good set of hairs. One could actually get a very successful hair transplant but poor looking hair over time if they did not use hair loss medication, because progressive hair loss could make the hair look worse even though all the transplanted hairs took. We allow and recommend washing daily after the day after hair transplant surgery. So the first 1 week of this washing is usually gentle, allowing water to run down the scalp and maybe patting it dry with a towel or using a blow dryer. And then a week later, we recommend gradually kind of washing by the fingers and lightly rubbing the scalp, because the pieces of skin that are transferred they dry up and cause scabs, and these scabs need to actively be washed off, or else they will stay for too long and actually prevent healing and the scalp getting air. And this is why we recommend a gentle wash for a week and then gradually start rubbing the shampoo so the scabs start coming off, because after a week there's no danger anymore to the transplanted hairs. And the rubbing should be increased gradually over the next week, and by the time it's 10 to 14 days there should be no scabs left, okay? And if there's scabs left, one should just roughly wash them all, so to make sure by 14 days there's no scabs. So what happens after that? So once the first 2 weeks are the scabby period, and then they come off, and then you see these tiny pieces of hair shafts from the grafts. But these tiny pieces of hair are actually not permanent because they don't have roots and cells connected to it. So these pieces of hair that came from the grafts will come off gradually, some of them with the scabs, some of them after the scabs have gone. So it'll take some days, and they gradually all come off, and then you end up with a scalp that doesn't show any signs of the grafts anymore. It will kind of it will look pink, and it'll be shaven, obviously, from the shaven procedure, but the scabs will come off, the tiny pieces of hair shafts will come off, and you won't see anything for some months, okay? And the first 3-4 months are called the ugly duckling period of hair transplant because there's no new hairs grown from the transplant yet. And you have these little signs of surgery, the pinkness, obviously you damage the skin and it heals. So if there's some existing hairs, they may be shocked, and there may be some loss from the existing hairs too. So it looks uglier than before, which is why it's called the ugly duckling period. And starting from months 3 and on, usually 4, 5, 6 months, you will see growth of new hairs, but they will not be synchronized. So some of the hairs will grow, some of them will grow later. Some at 4 months, some 5, 6, 8, 9, and it may take up to a year for all the hairs to actually grow. So it takes about a year to see the final result of a hair transplant. Now, what do we expect as a result? What density and coverage? Obviously, it changes from patient to patient, but let's assume we're transplanting on bald scalp because you have to separate transplanted within existing hairs versus transplanting on bare scalp. Okay, so transplanting on bare scalp, there are technical limitations to provide the density. Usually, a good density is about 50% original density because it's not technically possible to actually cut in so many holes and push in new tissue into an area as dense as native hair that we have. But good news is we don't need that amount because there's extra density in the hair. So as I mentioned at the beginning, 50% original density cosmetically gives an illusion of a full head of hair, which is roughly what we expect to get. But if you kind of shine light on it, if you wet it or apply grease, it may show a lack of density compared obviously to lack of density. But if you just dry comb a hair transplant, it should look decent enough and cover the scalp. Obviously, if one has advanced hair loss, it may not be possible to transplant the whole scalp at once, and so it may require multiple sessions. So once a hair transplant completely grows, you can start planning for future subsequent sessions if you need more hair transplants. Lastly, I would like to mention repair procedures because some patients may have had previous hair transplant procedures that did not work very well. So failed hair transplants, because a failed is a subjective term, can mean various things. So a failed or an unsuccessful hair transplant may mean lack of growth. So it may mean lack of growth, which leads to poor density. It may mean wasted donor hairs, which is bad news also because there's little hairs left. So the donor capacity is usually limited from these unsuccessful hair transplants. Poor growth means not all the hairs actually grew, so there's lost hairs from that as well. Or the result may look unnatural in its distribution, density, direction, and angles. So some cases which have a severe problem with one of these may also need removal of transplanted hairs and redistribution of these hairs once again, which is obviously even more difficult. Repair procedures need a high level of skills. So repair procedures are both costly and more difficult to perform. I can't give general information about repair procedures. It's a must to do a live consultation and examine patients who've had unsuccessful previous hair transplants. So I hope this general consultation tells you most of the things you need to know regarding general information. Obviously, you need a live consultation to get specific information about your own case. So if you are suffering from hair loss, you think you may be a candidate for a hair transplant, if you're considering one, you're welcome to contact our clinic by clicking the links provided, and we'll be happy to help you. Thank you and goodbye.